What's up? Doc Mike. Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for December 11, 2020. How youth-serving organizations can prevent child sexual abuse. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond talks with Johns Hopkins professor Elizabeth Letourneau about her major new report on how youth-serving organizations can best prevent child sexual abuse. Let's listen.
Elizabeth Letourneau, thanks for joining me.
It is my pleasure to be here, Stephanie.
So we could start by if you could tell me about your work sort of generally, because I don't know that our listeners know much about it.
Sure. So I describe my work as trying to identify solutions to child sexual abuse, and specifically to preventing child sexual abuse. So what works and what does not work to prevent child sexual abuse. And I've been in this line of work for a little over 30 years now.
Wow. And child sex abuse is sort of more common than most of us think. Is that right?
Yeah, I actually think people have got a pretty good grasp that this is a widespread public health problem. So somewhere between 25% of girls in the U.S. and 5 and 10% of boys in the U.S. and 12% of children worldwide are estimated to experience some form of child sexual abuse prior to the age of 18.
Wow, that's a large number to me.
It is. It absolutely is.
So I know that you, along with the Johns Hopkins Bloomberg American Health Initiative, have released a report on how youth organizations can more effectively prevent child sex abuse. Could you tell us a little bit about why you did this work and what you found?
Yeah, the impetus for the work was the fact that youth-serving organizations, many of them already actually do quite a bit to try to prevent child sexual abuse and to address it effectively when it happens. I mean, you can imagine that when child sexual abuse occurs in the context of a youth-serving organization, that puts the child at risk, obviously, of harm, but it also puts the organization at risk both for reputational harm and for monetary harm. And over the years, organizations have many of them have really come around to trying to get out in front of child sexual abuse and prevent it from happening. These have largely been siloed efforts, and so organizations have developed idiosyncratic approaches to preventing and addressing child sexual abuse, none of which have ever been evaluated. As a nation, we really don't put much resources into the science of child sexual abuse prevention. We do put those resources into the science of preventing child physical abuse and bullying and suicide prevention, but we're really just now getting around to the idea that we can prevent child sexual abuse and we should put resources into that. And so I would say largely because of a sort of an absence of resources, organizations have really been left on their own to figure out what to do and how to do it. And so my colleagues and I wanted to work with organizations, first of all, to get a sense of what are they already doing. We know they do a lot, but it's never really been listed out or identified. And then also look at how does what's already happening, how does current practice overlap with best practice recommendations, and best practice recommendations have proliferated recently. So that was the second goal. And the third goal is to see, is there maybe a way to do things differently that might help everyone? And we had this idea that there might be a way to streamline these procedures. And I can talk a little bit more about why we thought that in a little bit. But, again, the idea was just to bring some of the science, public health science to the issue of preventing and addressing child sexual abuse in the context of youth serving organizations.
And just for those of us who don't really know what a youth serving organization is, can you share?
Sure. Well, not to pick on anybody, but the organization that's in the news right this moment is the Boy Scouts of America. And so they are in the news because of a history in the past of not effectively addressing child sexual abuse within their ranks. And they are one organization that back in the 70s and 80s really fought against lawsuits that were brought by victims and victims' parents. But then in the late 80s, they really did an about face and began addressing child sexual abuse. They are one of the earlier organizations to implement some pretty broad and I think thoughtful child sexual abuse prevention and intervention practices. Boy Scouts of America and Boy Scouts of America was preceded in that effort by Big Brothers Big Sisters, who took seriously the issue of child sexual abuse before any other organization that I'm aware of. That doesn't mean they are the first, but they're the first that I know of that really went deep on trying to address this issue.
And when you say to address this issue, so what kind of things are we talking about?
Well, if we look at what what youth serving organizations have developed, so to stick with the Boy Scouts as an example, they developed a policy called the 2, as in the number 2 deep policy, which requires that there be 2 adults present anytime a child is present. And many people look at that rule and think, oh, that sounds perfect. The idea there is that you reduce the likelihood that an adult's going to sexually abuse a child if there's another adult present. And it on the face of it, it seems like a really good rule. But when you think about it for a little bit, it quickly becomes obvious how that rule might get broken. So if an adult is late, if somebody's late to showing up, or they get sick and can't show up, or if you've got 2 or 3 kids that have different needs, somebody needs to go to the bathroom, someone else needs close supervision because they're handling a knife, or starting a fire or whatever. This idea that there can always be 2 adults present breaks down pretty quickly. And there's some organizations like Big Brothers Big Sisters that are built around a mentorship model that relies on achieving its mission through one-on-one relationships between adult volunteers and kids. And so the 2D rule isn't going to apply to that organization at all. So, we knew there were these strategies that might work in some instances, but definitely don't work in all instances, and might not work in any instances for some organizations. To give another concrete example, Boys and Girls Clubs of America has also done a lot to try to prevent and address child sexual abuse, and they brought in an architect decades ago, this great guy, and they said, help us figure out how to make places safer. So they took what we call a situational approach to crime prevention, or to abuse prevention in this case. And what the architect worked on with them was, as with the Boy Scouts 2 deep rule, is how do you increase the visibility and the interruptibility, the monitoring of adult-child interactions? And they went about it by putting windows everywhere. So windows and doors and interior doors, so that even if a door was closed, it would be easy for somebody to look inside and see what was happening in that room or in that space. And I've been to their headquarters, Boys and Girls Club's headquarters in Atlanta. And even there, where there aren't very many children present on a regular basis, there are windows everywhere. So they really walk the walk on this effort, on this policy. And again, you can see, that makes a lot of sense. So if you just, there's times where you don't want the door open. Somebody over at Peabody teaching a 6-year-old to play flute, you do not want that door open, right? Because it's going to sound horrible. Nobody wants to hear that. But you still want the interaction to be observable and interruptible. So windows make sense. Again, it seems like a really great idea. And then again, when you think about it a little bit, you realize it could run up against barriers. For one thing, cost. So, it would be difficult to retrofit old buildings with a bunch of windows and doors. You can do it, but it costs money. You can design new buildings to facilitate line of sight, we call it. to make it easier, make sure there aren't things like shrubbery in between you and you as an adult watching the kids on the playground, and to reduce the number of corners and to shorten the long hallways and so on. But all of those things take planning, take funding. And so we knew about, my colleagues and I, Luciana Cini-Mayton here at Hopkins, here at the Moore Center, which I direct, Keith Kaufman at Portland State, Ben Matthews out in Queensland in Arizona, or Australia, Queensland University in Australia, and Don Palmer, who's at the University of California, Davis. We came together, and, between all of us, we knew all kinds of these individual, discrete policies. And we wanted to get a sense of what were all of them. So in the entirety, at least of the organizations that were willing to collaborate with us, what all were they doing, and sort of were there categories you could put them in, and did different groups have different strategies for the same goal? Mm-hmm. And so that's what we did. And we got four of the largest and longest serving youth serving organizations to partner with us, which even that was, I think, the kind of first of its kind, because this is a tough issue for youth serving organizations. On any given day, they face lawsuits. So this is a very tricky space for them to support research in, but they did, and they did it wholeheartedly. And we're really grateful for their collaboration. And, we learned a lot.
So what are you hoping will come from this?
What we're hoping will come from this is a more streamlined and more theoretically based approach. So what we found is, so these organizations that worked with us gave us all of their documents that had anything to do with preventing or addressing child sexual abuse. So they gave us policies, codes of conduct, trainings, fact sheets, everything. And it amounted to thousands and thousands of pages of documents. And so we had graduate students led by my doctoral student, Maggie Ingram, go through all of that and pull out each element that indicated a separate strategy. And there were more than 1,000 that we identified. And there's some overlap in there, but we identified something like 1,600 strategies across 4 organizations. And that's a lot of strategies. And Don Palmer, we brought onto our team because his expertise is in organizational sociology. And what organizational experts know is that you don't get adherence to rules by having 1,000 different rules. That actually reduces adherence to rules because it's impossible to make sure that you're adhering to that many different rules in any given time. And then, as I said, there's really obvious ways in which so many of these would be broken on possibly on a routine basis. And then you're actually inculcating this idea that it's okay to break these rules. So it's not even just no harm by having a rule that doesn't work. There's the potential for developing a norm of rule breaking in an organization around child sexual abuse, which is the very last thing anyone wants to do. We're all in this to try to keep kids safe and healthy and happy. So our goal was to identify everything that was being done, and then, as I said, to crosswalk that or compare that with best practice recommendations. And what we found is these organizations really were implementing most of the best practice recommendations. But what we saw was that anytime there was a new thing like social media, so now there's another way that people can get into trouble or cause trouble with children, there would just be a new rule. There was not overarching guidance around, what is the thing we're really trying to do with this rule? There was just a new rule. So you're never allowed to call or text a kid. Well, what if you have to? Right? You're never, you can't drive a kid home. Well, what if mom forgets to pick the kid up? You just going to leave the kid there? You're not. What if you're worried about a child? And so we, again, what we thought we might be able to do, and what we think we did do, is to identify some overarching concepts that might help people think about, all right, what is the actual goal? And then figure out, for my organization, for this local setting, what works to achieve that goal. And it might be one thing here, and it might be the 2D thing here, it might be windows here, it could be something else entirely over here. But what's going to work for us? But just to have a sense of what are really the overarching goals. And so we came up with 8 overarching goals that we felt like all of the 1,600 or so strategies that are implemented. And also, I should say, we identified 260 discrete best practice recommendations. And again, nobody's going to be able to implement 260 discrete best practice recommendations. It's an unreasonable expectations of youth serving organizations. And I think it creates such a burden that we really risk organizations just not being able to function. So we came up with 8 that we think most of these rules and strategies fit under. And the idea then again is just to get leaders at youth serving organizations, whether it's at the national level or the local, the parents that are running a softball team, to just think through, like, these are the 8 things we think align with any youth serving organization, regardless of what their mission is. These are the 8 things that we think you need to be aware of. You need to have some strategies for at your site. And then, we provide some exemplars of what those strategies might be, but we recognize that there's dozens sometimes, and eventually, we're not there yet. Eventually, we'd like to have the website feature all of the possible strategies that we identify and think are reasonable. And then the other thing is that we want to subject these to research, which we still have not yet done, and that remains to be done. So which of these strategies actually achieve the goal of keeping kids safe?
Well, Elizabeth Letourneau, thanks so much for joining me.
Oh, it's my pleasure.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.